My name is Talia Eisenberg, and I'm an entrepreneur, a wife, and a mother. However, my story today begins on September 7th, 2007, when, like many other people across the United States, I had a dentist appointment for a routine procedure. As expected, I was given pain medication to reduce my discomfort during and after the procedure. I left the appointment and, as directed, went to a pharmacy on my way home and took a 10 milligram tablet of Vicodin to help me rest and recuperate. This action changed my life forever. Like 15 million Americans each year, I was pain-free, without discomfort, and able to begin healing from this otherwise routine root canal. But I also felt much more. I took the Vicodin as prescribed. It gave me a feeling that I hope I never forget. For the first time in my recent memory, I had an overall pleasant numbness and separation from a sense of dread and anxiety that I had not previously understood. I had no awareness of the changes that were taking place in the neurochemistry of my brain, but I continued to take the medication and was increasingly aware of a shift in my outlook, energy, and sense of peace and satisfaction with my life. My anxiety was erased, and the constant worries of being a young adult and making life choices faded. When this prescription ran out, I had forgotten about the dental procedure. No follow-up appointment was required, but I had 2 refills available, so I visited the pharmacy to receive more and more medication. More prescriptions were filled. This continued for months until eventually I was informed that no additional refills were available. More than disappointment, I had a feeling of dread as I was aware of my physical dependency. I experienced severe withdrawal symptoms. I found alternative sources of opiates to maintain feelings of pleasure and to avoid withdrawals. I turned to the secret use of what I was told was opium and then heroin to stave off withdrawals, and I continued to seek the pleasures of continuous use of opiates. I can say now what I could not reveal as a woman in my early 20s. I was a heroin addict. I knew I did not want to continue this behavior. I tried to reduce my dependency, but I could not endure the symptoms of withdrawal for more than a few hours. I went in and out of rehabs to try and get and stay sober, but would relapse within weeks of my discharge. My family invested hundreds of thousands of dollars and experienced untold stress and trauma. I worked to find a community of people that used opiates. I was able to acquire pills through doctors, friends of friends, or referrals, and sometimes heroin off of the street. I am forever grateful that fentanyl had not yet entered the illicit drug supply, or I would likely not have had the opportunity to change my life, get an MBA, become a successful entrepreneur, a mother, a spouse, and honor the generosity and love of my family, or be standing before you today. I was 23 when I contacted a friend with whom I had used opiates to ask where I could get more. To my surprise and dismay, he said he was clean, happily married, and working a full-time job that he really loved. He was no longer using opiates. He explains that he had returned from a trip to Mexico to try a plant medicine called ibogaine. I had never heard of this substance, but I knew this friend very well, and if it had, in fact, enabled him to stop using and have the strength to stay stopped, I knew I needed to try it. I did some quick internet research. I read about certain risks, but I rationalized that the risk could not be worse than my using IV heroin. I called a clinic and bought a plane ticket to Mexico. I went to a place that was unequipped to provide safe ibogaine treatments. It was what I would call a drive-through detox, and frankly, it was just fine with me. It had no medical infrastructure, no psychotherapy, no preparation or aftercare, and no vision for my long-term recovery. I have since learned that these are core requirements for increasing the success of ibogaine-assisted treatment. I took a few capsules of ibogaine and I endured a 12-hour experience that was quite nightmarish. I know now it could have been beautiful, but for the lack of any psychotherapeutic preparation, the absence of trained, experienced medical professionals, no clinical infrastructure, no nursing support, and absence of any aftercare or long-term therapeutic integration, I now know precisely how ibogaine can be administered safely and effectively to individuals and at scale. However, the ibogaine achieved what no other therapy or intervention had yet. Soon after leaving, I was able to receive supplementary doses of ibogaine, and I was totally free from withdrawals for the first time in years. And the psychological symptoms abated with time, along with support from therapists who truly understood the psycho-spiritual aspects of the ibogaine experience, which accelerated my healing. I have not had an opiate, a legal stimulant, or alcohol since the ibogaine experience almost 15 years ago. The ibogaine experience contributed much more than a reset of my neurochemistry. I did not experience the deep depression that had accompanied my past efforts to taper or titrate my use of opiates, which always led me to go back. I felt a strong aversion to the idea of using opiates after my ibogaine experience. I recall going from being unable to not take an opiate to feeling a very strong desire to never use an opiate again, and almost feeling sick from the thought of taking any. More compelling and important was a deeply personal and profound sense of purpose underlying my desire to expand my experience of recovery and develop new skills and understanding of the purpose of my existence, far more than detox, which I had experienced numerous times at other rehabs. I felt a newfound passion for pursuing a life of meaning and growth and helping others. This was absolutely unlike any other experience of getting sober. I had the clarity and desire to make life changes. I was connected to a sense of affirmation, meaning, and felt motivated to understand it better. I had been a hopeless heroin addict mere hours before this began. The ibogaine showed me how the opiates were poisoning my body and my mind, and I vowed then, during the experience, to never put this poison in my body again. Since this time, I have contributed to making access to medically safe, scientifically based, ethical ibogaine-assisted treatment for chemical dependency, mood disorders, and PTSD possible. I want every person in Kentucky and beyond who has come to identify with their problem of chemical dependency to experience their version of my transformation. This is why I co-founded an ibogaine addiction and trauma treatment center in Cancun, Mexico. Now I spend all day, every day, talking with parents and loved ones of people who have tried every other available method to find relief from addiction to opiates, increasingly fentanyl, as well as veterans, first responders, active duty military, and law enforcement personnel who have truly run out of options and hope for relief from PTSD and suicidal ideation. I can think of a no more worthy cause than to invest in this research and development of clinical infrastructure for ibogaine here in Kentucky, so citizens of this great state are no longer forced to go abroad but can achieve healing at home. You will be truly helping those whose lives have been stolen by dependency to opiates and who feel devoid of depth and meaning to achieve a rapid and robust level of healing that current treatments simply cannot and do not match. It is inspiring to see so many people leave ibogaine treatment not only free from the grasps of dependence and pain of withdrawal, but also motivated by a deep desire to help others achieve similar healing, growth, and recovery. This was my experience nearly 15 years ago, and it is why I am here today to tell my story. Thank you for allowing me to do so.